Thank you. I now yield myself my time for questions, and I thank you both for your testimony today. Mr. Hackbarth, we're sort of picking on you, I think, but you can tell from the questions that Medicare payment reform seems to be a very pressing issue for many of us. And one of the Medicare payment reforms we're suggesting in this legislation is a change to the GYPSY formula in California so that it is now based on MSAs, Metropolitan Statistical Area. Two of the counties I represent in California are negatively impacted by the current payment formula. Physicians in both San Luis Obispo and Santa Barbara counties are paid less, much less, they would say, than the actual cost of practicing medicine. My question to you is in general, but also specifically toward California. Will the GYPSY provisions improve the accuracy of payments in the new fee schedule areas that you, across the country, as you have envision them?
Yeah, the provision related to California in the bill is based on one of two options that MedPAC developed for CMS back in, I think it was 2007. So the approach in the bill is consistent with the advice that we've given CMS.
Excellent. And then maybe you could elaborate a little bit on the benefit, obviously, that you are seeing from having physician payment areas aligned with hospital payment areas. And is that, again, consistent around the nation once we get our alignment correct in California?
Well, the issue that we focused on was specific to California. As you know, the GYPSYs work differently in different states. And so our recommendation wasn't that this approach be applied everywhere, but we saw it as a reasonable solution to the California issues that you and other members have raised.
Now, we have seen that other areas of the country have this disparity as well, but do you think those are best resolved on a regional basis?
Yeah, different states have elected to resolve it differently, and we think the problems are not national in scope, but more isolated, and the more tailored approaches are the best way to go.
And that would be a pattern that you might suggest in other areas as well, that we look at regional issues, particularly at least in the payment schedules?
Yeah, well, you know, that's a big statement, and
I'm just wanting to see how far you want to go.
Yeah, I'd like to take a look at, consider the issues one by one, as opposed to make that as a broad policy statement.
Well, I know my California colleagues that this has been a real serious detriment to Medicare in the practice of Medicare in our state. In many of the regions, that the cost of living has been very different from what the allotment has been. So this becomes for us a really vital component of Medicare reform. Yes. Under this bill.
And as I say, we think the approach in the bill is a reasonable one, and it's one of the options that we recommended to CMS.
Okay, I'm going to yield back my time. And recognize Mr. Bouyer for his questions.